patient with schizophrenia says, we can pan, scan, run, plan. The nurse identifies this as which speech abnormality? A. Echocallia, B. Word salad, C. Neologism, and letter D. Clang association. Ang sagot po natin dito is letter D. Clang association. Words that rhyme or sound alike used in an illogical, nonsensical manner reflect clang association. Nonsense po. Nagra-rhyme nga siya, pero illogical and nonsense din. That is called clang association. Echocallia involves the meaningless repetition of words or phrases. For example, the nurse says, "How are you today?" And the client repeats, "How are you today?" Inuulit-ulit lang po. Meaning, ine-echo niya yung sinasabi ng nurses. Yan po ang echocallia. Word salad naman, it involves illogical word groupings such as, I saw the star, the barn, plant. Wala din pong meaning, illogical word groupings. That is word salad. Okay? Neologisms are bizarre words that have meaning only for the patient. We're going kerfluktering. Agasim nga. May iba siyang word. Okay? The patient makes new words. That is neologisms. Basta ang sagot natin dito is letter D. Clang association, words that rhyme or sounds alike pero illogical and nonsensical. Okay? Nagra-rhyme. Number 24. Which of the following manifestations is most prominent characteristics of borderline personality disorder? Again, which of the following manifestations is most prominent characteristics of borderline personality disorder? Ang sagot po natin dito is letter C. Instability in personal relationships. Again, instability in personal relationships. The prominent characteristic of borderline personality disorder is the patient's instability in personal relationships, mood, behavior, and self-image. Again, the prominent characteristic of borderline personality disorder is the patient's instability in person relationships, mood, behavior, and self-image. Okay. Suspiciousness is most commonly associated with paranoid personality disorder po. Reckless disregard for others and unlawful behavior are typically associated with antisocial personality disorder po. Okay, so ang sagot natin dito is letter C. Number 25. During a panic attack, a patient experiences breathing difficulty, chest pains, palpitations, and pallor. Which of the following nursing actions should the nurse do first? A. Assist with breathing into a paper bag. B. Orient the patient to people, time, and place. Letter C. Set limits for acting out delusional behaviors. And letter D. Administer an anxiolytic IM. Ang sagot po natin dito is letter A. Assist with breathing into a paper bag. Physiologic needs po, especially breathing, are the first priorities during a panic attack. Restoring normal breathing patterns should relieve other symptoms. Okay. Number 26. A patient with major depression tells the nurse, "Life isn't worth living. I can't stand the pain any longer." What is the nurse's best response? A. Sometimes when people feel depressed and helpless, they feel like hurting themselves. Do you feel like hurting yourself? B. Perhaps you should discuss this in a group therapy today. Letter C. I think you may want to take a dose of lorazepam now. And letter D. You don't feel like living? The correct answer here is letter A. Sometimes when people feel depressed and helpless, they feel like hurting themselves. Do you feel like hurting yourself? Since the patient has verbalized passive suicidal ideation, the nurse should begin a suicidal assessment with a direct question about the suicide. I-direct mo na agad. In general, group therapy isn't the forum to deal with suicidal ideation initially, so mali po ang ating letter B. Offering medication is not appropriate as an initial intervention for suicidal ideation. And in this case, using reflection trivializes the patient's comment. Okay? Number 27. A patient with bipolar disorder is in the manic phase. She dresses flamboyantly, acts provocatively, and has seriously impaired judgment. What is the nurse's first priority when planning this client's care? A. Administer lithium carbonate IM. B. Provide a safe, non-stimulating environment. C. Begin aversion therapy to extinguish undesirable behaviors. And letter D. Initiate suicide precautions. The correct answer here is letter B. Provide a safe, non-stimulating environment. The patient with manic symptoms is easily overstimulated and has impaired judgment. The nurse should observe him closely to protect him from acting on dangerous impulses. The nurse should provide a safe, non-stimulating environment. Lithium carbonate is available only in oral form. So mali po ang ating letter A. Aversion therapy is inappropriate because the client can't control his behavior. The patient hasn't displayed suicidal intentions. However, the nurse should be alert for rapid changes in mood which may place the patient at suicidal risk. Basta our answer here, the nurse's first priority when planning client with bipolar disorder in the manic phase is to provide safe, non-stimulating environment. Letter B. Number 28, the nurse tells the patient who refuses to take oral medication that if the medication isn't taken, restraints be applied and the medication given by IV injection. The nurse is liable for which of the following legal tort? Ang sagot po natin dito is letter D, assault. Assault occurs when a person puts another person in fear of harmful or threatening contact. Okay? The patient has the right to refuse care. Negligence involves actions below the standard of care. Battery is the actual contact with one's body. If the nurse actually carried out the threat, battery is committed. Okay, so our answer here is assault. Tinatakot mo yung patient. Okay? Number 29. A 50-year-old patient with paranoid schizophrenia believes that the Red Army is coming to take out his brain, and a roommate is a Central Intelligence Agency spy. The patient has employed for the past 20 years. The nurse recognizes this patient has failed to achieve which of the following psychosocial tasks? A. Autonomy. B. Generativity. Letter C. Integrity. And letter D. Trust. Obviously, our answer here is letter D. Trust. This patient's paranoid ideation indicates difficulty in trusting others. Autonomy indicates independence, cooperation, and self-control. Generativity naman is giving back to society, and integrity is accepting positive and negative aspects of one's life. Basta ang sagot natin dito is letter D. Number 30. Before eating a meal, a patient with obsessive compulsive disorder must wash his hands for 30 times, comb his hair 155 strokes, and switch the bathroom light on and off 35 times. Grabe naman. Which of the following is most important long-term treatment goal for this client? A. Omit one unacceptable behavior each day. Letter B. Increase the client's acceptance of the therapeutic drug use. Letter C. Allow ample time for the client to complete all rituals before each meal. And letter D. Systematically decrease the amount of time spent in and the number of repetitions of rituals. Ang sagot po natin dito is letter D. Systematically decrease the amount of time spent in and the number of repetitions of rituals. The long-term goal when caring for a client with OCD is to systematically decrease the undesirable behavior. Sorry po. Expecting to omit one behavior a day is unrealistic. Drug use is to be viewed with caution. Allowing time for all rituals perpetuates or sustains the undesirable behavior, although should be allowed during the early part of the hospitalization. Treatment aims to decrease and ultimately eliminate ritualistic behaviors. So, ang ating sagot for the long-term treatment is letter D. For the long-term treatment, systematically decrease the amount of time spent in and the number of repetitions of rituals. Okay? Number 31. During admission, a patient with schizophrenia suddenly turns to the next chair and whispers, "Now, just leave. I told you to stay home. There isn't enough work here for both of us." Which of the following is the nurse's best initial response? Grabe, nakakatakot naman yun. A. When people are under stress, they may see things or hear things that others don't. Is that what just happened? I am having a difficult time hearing you. Please look at me when you talk. Letter C. There is no one else in this room. What are you doing? Letter D. Who are you talking to? Who are you talking to? Are you hallucinating? Ang sagot po natin dito is letter A. When people are under stress, they may see things or hear things that others don't. Is that what just happened? Yan po ang ating tamang sagot. This response acknowledges that the experience of hallucinations is real to the patient, and this promotes an open therapeutic relationship. Confrontational approaches are likely to elicit an uninformative or negative response. So our answer here is letter A. Okay? Number 32. Which statement by the patient with obsessive compulsive disorder indicates the need for reassessment by the nurse? Indicates the need for reassessment by the nurse. A. I must work overtime every night this week or the job won't get done right. So obviously, ang sagot natin is letter A. I must work overtime every night this week or the job won't get done right. The patient's statement indicates a perfectionist tendency and an excessive focus on work to the exclusion of social or leisure times. Letter A po. Okay? Number 33. A patient with major depression is taking Parnate, a monoamine oxidase inhibitor. Which foods should the nurse teach this patient to avoid? Select all that apply. A. Poultry. B. Whole grain bread. Letter C. Aged cheese. And letter D. Fresh fish. Letter E. Wine. And letter F. Preserved fruits. Ang sagot po natin dito is letter C. Aged cheese. Letter E. Wine. And letter F. Preserved fruits. The patient should avoid tyramine-rich foods when he is on Maui therapy. This is to prevent hypertensive crisis. Okay? Aged cheese, wine, and preserved fruits are tyramine-rich foods. Pansinin ninyo guys, yung mga tyramine-rich foods ay yung mga pagkaing tumatagal, like yung mga aged cheese, yung mga pagkaing na preserve, and yung mga fermented foods. Yan yung mga tyramine-rich foods po. Huwag po nating kalilimutan. Sagot po, C, E, and letter F. Number 34. An adolescent had been observed by his parents and teachers to have been irritable, becoming increasingly withdrawn, and had been getting lower grades on his schoolwork. After giving away an iPad and some favorite cups, the patient is brought to the community mental health for evaluation. Which of the following problems is the adolescent at risk for? A. Suicide. B. Anorexia. C. School phobia. And letter D. Psychotic episode. Our answer here is letter A. Suicide. The behavior of the adolescent indicates that he is contemplating suicide kasi irritable na siya, increasingly withdrawn, and had been getting lower grades on his schoolwork at pinamigay na din daw yung kanyang iPad and some favorite cups. Okay? Again, sagot po natin is letter A, suicide. Number 35. A patient with catatonic schizophrenia is mute, unable to perform activities of daily living, and stares out the window for hours. What is the nurse's first priority in this situation? A. Assist the patient with feeding. B. Assist the patient with showering. Letter C. Reassure the patient about safety. And letter D. Encourage socialization with peers. Sagot po. Our answer here is letter E. Assist the patient with feeding. According to Maslow's hierarchy of needs, the need for food is among the most important. Okay? Our answer here is letter E. Assist the patient with feeding. First priority po yung tinatanong. Number 36. A week ago, a patient with chronic schizophrenia received 20 mg of flufenazine decanowate by IM injection. The patient is presently experiencing muscle contractions that contort the neck. Which of the following extrapyramidal reaction is the patient demonstrating? A. Dystonia. B. Akinesia. C. Akathisia. And letter D. Tardive dyskinesia. Our answer here is letter A. Dystonia. Dystonia is manifested by muscle spasms in the tongue, face, neck, and back, and sometimes legs. Akinesia refers to the decreased or absent movement. Akathisia naman is described as restlessness or inability to sit still, and tardive dyskinesia is the abnormal muscle movements, particularly around the mouth. Okay? Basta ang sagot natin dito is letter A. Dystonia. Number 37. Which of the following is the best nursing intervention for the elderly patient with senile dementia who experiences insomnia and nocturnal roaming? A. Administer a benzodiazepine at bedtime as prescribed. Letter B. Administer a phenothiazine at bedtime as prescribed. Letter C. Administer barbiturate at bedtime as prescribed. And letter D. Lock the patient's door at bedtime. Our answer here is letter B. Administer phenothiazine at bedtime as prescribed. For elderly patients, phenothiazines are preferred for thought clearing and sedation. Again, for elderly patients, phenothiazines are preferred for thought clearing and sedation. Benzodiazepines usually are avoided because of risk of addiction, cardiovascular complications, and interruption of motor coordination. Barbiturates also are avoided because they can cause delirium, confusion, excitement, and addiction. Locking the door is inappropriate and violates the patient's right. Bawal pong ilock. Again, our answer here is letter B. For elderly patients, phenothiazines are preferred for thought clearing and sedation. Number 38. A patient with antisocial personality disorder smokes where it is prohibited and does not follow unit and hospital rules. The patient gets others to do the laundry and other personal choices, tries to divide the staff, and works only with certain nurses. The primary focus of the patient's care plan should be A. Consistently enforcing unit rules and hospital policy. B. Isolating the patient to decrease contact with easily manipulated patients. Letter C. Engaging in power struggles with the patient to decrease the incidence of manipulative behavior. And letter D. Using behavior modification to decrease the amount of negative behavior by using negative reinforcement. Ang sagot po natin dito is letter A. Consistently enforcing unit rules and hospital policy. Firmness and consistency about rules are the hallmarks of care plan for a patient with personality disorder. Huwag po nating kalilimutan. Number 39, the nurse is admitting a patient to chemical dependency unit for alcohol detoxification. When asked about alcohol use, this patient is most likely to. Again, the nurse is admitting a patient to the chemical dependency unit for alcohol detoxification. When asked about alcohol use, this patient is most likely to. Our answer here is letter B. Underestimate the amount consumed. Okay? The rationale here is most people who abuse substances tend to underestimate their consumption in an attempt to conform to social norms or protect themselves. Okay? Ang sagot po natin dito is letter B. Underestimate the amount consumed. Number 40. A patient with major depression sleeps 18 to 20 hours a day, has given up his swimming lessons, and has lost 20 pounds in weight in 3 weeks. Which of the following drugs is usually given as the first-line antidepressant? Our answer here is letter B, fluoxetine, Prozac. A selective serotonin uptake inhibitor is used as the first-line drug therapy for major depression because it has fewer side effects as compared with other antidepressant. Therefore, our answer here is letter B, fluoxetine, Prozac, first line po. Number 41. When assessing a 12-year-old girl for possible sexual abuse, which of the following physical signs or symptoms should the nurse look for? Select all that apply. A. Difficulty walking or sitting. B. Dressing inappropriately for the weather. C. Listlessness and tiredness. Letter D. Bruises, edema, and pain in the genital area, vagina or rectum. Letter E. Frequent urination or dysuria. Letter F. Anorexia. Letter G. Foreign in the bladder, rectum, urethra, or vagina. And letter H. Bulimia. Physical symptoms po ang tinatanong, so our answer here is letter A, letter D, letter E, and letter G. Yung letter A, difficulty walking or sitting, tama po yan. Bruises, edema, and pain in the genital area, vagina or rectum, tama din po. Letter E, frequent urination or dysuria. And letter G, foreign in the bladder, rectum, urethra, or vagina. Signs and symptoms of sexual abuse po. Ito yung mga physical signs and symptoms of child with sexual abuse. Dressing inappropriately, listlessness, and tiredness are signs of physical neglect in the child. Anorexia and bulimia are behavioral changes of emotional abuse in a child. So, mali po yung mga yan. Number 42. An 89-year-old patient is suffering from Alzheimer's type dementia. Which intervention would be most useful in managing his dementia? A. Provide a safe environment. B. Provide a stimulating environment. Letter C. Avoid the use of touch. And letter D. Use restraints whenever necessary. Obviously, ang sagot po natin dyan is letter A. Provide a safe environment. Providing a safe environment ensures safety when a patient has poor judgment, memory loss, and an unsteady gait. Overactivity and noise can overstimulate the patient with Alzheimer's disease by causing agitation. The use of restraints can also increase a patient's agitation. Again, our answer here for the most useful in managing dementia is letter A, provide a safe environment. Number 43. A patient receiving Nardil, phenelzine sulfate must be taught to avoid which of the following foods? Ang sagot po natin dito is letter B. Since ang Nardil is a MAOI drug, bawal po sa kanila ang foods high in tyramine. Nasabi na natin to kanina. The client on monoamine oxidase inhibitors like Nardil must avoid tyramine-rich foods to prevent hypertensive crisis. Tyramine-rich foods include coffee, tea, cola, beverages, aged cheese, beer and wine, pickled foods, avocados, and figs. Okay? So, ang sagot po natin dito is letter B. Number 44. Which of the following signs and symptoms indicate lithium toxicity? Ang sagot po natin dito is letter C. Diarrhea, ataxia, seizures, and letter G. Lithium toxicity is a serious problem for patients with bipolar disorders. Symptoms include diarrhea, confusion, ataxia, slurred speech, and hypotension. Tandaan lang po natin yung mnemonic na D-CASH. D for diarrhea, C for confusion, A for ataxia, S for slurred speech, and H for hypotension. D-CASH. Okay? Acute toxicity causes seizures, oliguria, coma, and death. Basta ang sagot natin dito for lithium toxicity is letter C, diarrhea, ataxia, seizures, and lethargy. Number 45. A patient with schizophrenia is incontinent and urinates on the floor. The nurse's best response would be to A. Ask her to clean up after herself. B. Tell her that ward privileges will be withheld if it happens again. And letter C. Ignore the client until her behavior improves. And letter D. Clean up the urine without communicating displeasure. Our answer here is letter D. Clean up the urine without communicating displeasure. The nurse, by his or her attitude and approach, conveys interest and caring. This option maintains patient dignity, it reduces anxiety and stress, it avoids negative reinforcement, and it also fosters trust. Sa letter A, ask her to clean up herself, it may increase anxiety and shame. Yung letter B naman, withholding privileges may reinforce negative behavior. And yung letter C, ignoring the patient may exacerbate feelings of isolation. So our answer here is letter D, clean up the urine without communicating displeasure. Number 46, malapit na tayo matapos. Anos lang. A patient taking lithium or escalate would most likely experience which of the following signs and symptoms? Ang sagot po natin dito is letter A, increased thirst, increased urination. The nurse needs to monitor lithium blood levels. There is high incidence of increased thirst and increased urination. The nurse must assess patients at the risk of developing toxicity and report polyuria, prolonged vomiting, diarrhea, or fever. Okay, so our answer here is increased thirst, increased urination for patient taking lithium or escalate. Number 47. An elderly patient begins to cry during morning care. Which question by the nurse would be most appropriate and solicit the best response by the patient? A. Why are you crying? B. What's the matter with you? Letter C. You're not going to cry again, are you? Letter D. You seem very sad. Can you tell me what's bothering you? This is a very common type of question po, and our answer here is letter D. You seem very sad. Can you tell me what's bothering you? This is using open-ended question. Open-ended questions identify the problem, convey concern, and produce more information. Focusing on client's feelings is therapeutic, okay? Huwag po nating kakalimutan, our answer here is letter D. You seem very sad. Can you tell me what's bothering you? Yan, very therapeutic po kung pakinggan. Number 48. The nurse is caring for patient, a Gulf War veteran who exhibits signs and symptoms of post-traumatic syndrome, which include A. Hyper-alertness and sleep disturbance. B. Memory loss of traumatic event and somatic distress. Letter C. Feeling of hostility and violent behavior. And letter D. Sudden behavior changes and anorexia. Ang sagot po natin dito is letter A. Hyper-alertness and sleep disturbance. Signs and symptoms of post-trauma syndrome include hyper-alertness, sleep disturbances, exaggerated startle, survival guilt, and memory impairment. The client relieves the trauma through dreams and recollections. Yung hostility, violent behavior, and anorexia are not usual signs or symptoms of PTSD. Okay, number 49. An agitated acting out delusional patient is receiving large doses of haloperidol, and the nurse is concerned because this drug can produce untoward effects. The nurse should be aware that the drug will immediately be stopped if the patient exhibits. Ang sagot po natin dito is letter E, jaundice. Jaundice signifies liver function interference and requires stopping the medication. Again, jaundice signifies liver function interference and requires stopping the medication. If EPS symptoms occur, the dose needs to be reduced. Hindi po ini-stop agad. But if symptoms do not subside, dito na po yung time na dapat i-stop. Dizziness and sleeplessness subside after few weeks of therapy. Okay? So, our answer here is letter A, jaundice. Pag meron pong jaundice, dapat ini-stop na agad. Number 50, last question. Congratulations. Which finding would the nurse expect to assess in a patient who ingests alcohol and is also taking disulfiram? Select all that apply. A. Chest pain. B. Hypervolemia. C. Tachycardia. D. Blurred vision. And letter E. Headache. And letter F. Hypotension. Ang mga sagot po natin dito is letter A. C, D, E, and F. A, chest pain. C, tachycardia. Letter D, blurred vision. Letter E, headache. And letter F, hypotension. A client who consumes alcohol up to 2 weeks after taking disulfiram will experience a reaction that includes chest pain, shortness of breath, nausea, vomiting, facial flushing, headache and red eyes, blurred vision, sweating, tachycardia, hypotension, and fainting. So, yan po ang ating mga sagot. Letter A, C, D, E, and F. This is our last item and thank you for enduring this rationalization and I hope na meron man lang kayong natutunan kahit konti. Maraming salamat po. Mahal na mahal ko po kayo. See you tomorrow.